Hello, this is a three-dimensional model of the human heart, and I thought it would be a great structure to talk about the basics of the anatomy and physiology of the heart for beginners. The heart has four chambers, as you all are aware. The right atrium and the right ventricle on the right side. Actually, the right side of the heart is shown on the left side of the screen here because we're facing the heart from the front. So right atrium and right ventricle, and the left atrium and the left ventricle on the left side. The ventricles are separated by the wall called interventricular septum, and the atria on top are separated by a wall called interatrial septum. The major function of the right side of the heart is to bring the impure blood or deoxygenated blood from the rest of the body back to the heart so that it can be pumped towards the lungs or the pulmonary circulation, and the lungs can oxygenate them and give it back to the heart. I'm talking in very simple terms here. From the upper part of the body, including the brain and the upper extremities, the impure blood enters the right atrium through the superior vena cava, which is that blue vessel on top. And at the bottom, you see a blue vessel, which is called as the inferior vena cava. It brings the blood from the lower part of the body back to the heart. So once the blood reaches the right atrium, it enters the right ventricle through a valve, and that valve is called the tricuspid valve. It's easier to remember the tricuspid on the right side because it kind of rhymes, tri and ri. So once the impure blood reaches the right ventricle, the role of the right ventricle is to pump it towards the pulmonary circulation so that it can get oxygenated. The pulmonary circulation carries impure blood. What you see there is the pulmonary trunk, which divides into the right and the left pulmonary arteries. So usually when we talk about arteries carry pure blood to any organ except for the pulmonary artery, because pulmonary artery's role is to take the blood to the lungs so that it can get oxygenated. The lungs by itself are supplied by the bronchial arteries. So the pulmonary artery divides into the right and the left pulmonary artery, and from the air that we breathe in that contains 21% oxygen, the oxygen diffuses into the pulmonary circulation, and the pure blood, now the blood that carries more oxygen or oxygenated blood, goes back to the heart, to the left side of the heart through four pulmonary veins. You can actually clearly see two pulmonary veins, and there are two more on the other side. I don't think it's that clearly visible here. But four pulmonary veins, so pulmonary veins again are the only veins that carry the pure blood, okay, into the left side of the heart. And the left atrium and left ventricle are separated by that valve, which is called as a mitral valve. Now the heart muscles by itself are called the myocardium. The role of the left ventricle is to pump the blood into the aorta, which carries the pure blood into the systemic circulation. We call it systemic when it gets sent to all the systems in the body. So if you look into the wall of the left atrium versus left ventricle versus the right ventricle, the left ventricle is usually way thicker, they're way stronger than the right. It's because it is constantly pumping against a highly resistant aorta. So when we talk about arteries, we call them resistance vessels, and the veins are called capacitance vessels. Arteries are highly resistant, and when the left ventricle constantly pumps at a rate of 60 to 100 on a normal person against the aorta, the muscle walls become thick, the muscle wall becomes thick, and it also becomes pretty strong. So the aorta, the role although is to carry the blood to the rest of the body. There are three branches that go up to the brain, and that was the one that you see on the right side is the innominate artery, and then you have the common carotid, and then you have the left subclavian artery. The role of the aorta again is to take the blood from the heart to the rest of the body. Now the heart itself is supplied by arteries that are called coronary arteries, and the coronary arteries arise from the root of the aorta. The two major coronary arteries are the right coronary artery that goes to the right side of the heart, and the left coronary artery that goes to the left side of the heart. So that's the left coronary artery. If you see the left coronary artery goes straight down, that divides into two, that's the left circumflex, and the one that goes straight down is the left anterior descending. Left circumflex supplies the lateral wall of the heart, which is that side of the heart that I'm showing. Anterior descending supplies some of the septum and major part of the left ventricle. Versus the role of the right coronary artery is to supply the right side of the heart and some of the and the inferior wall of the heart. So right coronary artery for the right side, left coronary artery majorly for the left side. Left divides into circumflex and anterior descending. Circumflex has some, they all have some marginal branches, but circumflex mostly lateral. There is a branch called posterior descending artery, which could be, well, in 60% of the patients or per people, it is a branch of the right coronary, and 30% it's an extension of the left circumflex. And if you've heard about the term left and right dominant, that's where it comes from. So these arteries have to go in. So it goes epicardial, which is on top, but it also has to go transmural, which means it has to go through the thickness of the wall of the ventricles and supply the ventricles. And that's why the left ventricle is usually not supplied during contraction, which is a whole different topic we can talk about a different day. Now I'm just going to show you a 360-degree rotation of the whole heart, and this heart looks like a coconut, actually, this size, but the actual size is the size of a fist. It's as small. So to me, this organ is such an amazing organ. I'm always fascinated by how this organ works, because such a small organ, and by the third or fourth week of conception, it starts beating on its own, and it's automatic, it's spontaneous, it starts beating on its own. And everything that we have learned in science, including like physics, mechanics, statics, dynamics, you name it, some chemistry, it all is applied in the physiology of this amazing organ. So it's always fascinating. I myself has worked as a cardiothoracic ICU nurse for 7 years, and I, in nurse anesthesia, am involved in a lot of surgeries in and around the heart, mostly aortic aneurysm repairs, carotid artery repairs, a lot of ablations of the heart, valves, closures of some of the openings in the interatrial and interventricular septum. So to me, I'm always fascinated by this organ.